Absolutely. Absolutely.
Okay, that's great then. Okay. So, Congressman, let's start out by talking a little bit about your impassioned speech on the floor of the House last night. You talked about this legislation being good for the people of Albany. What makes this good legislation for the people of Albany?
Well, obviously, there's a number of factors associated with the bill. For the Capital Region, for the 21st Congressional District, there are many people that will be favorably impacted by the largest health care tax cut for middle income Americans in our nation's history. And so with many households getting visited with that benefit, some 149,000 families will be favorably impacted, as will 14,500 small businesses. That's a huge lift and a benefit so that they can afford to either embrace employer-based healthcare coverage, or as a family, if they're doing it on their own, to have that tax credit. I think it's absolutely important. For instance, a family of four with an annual household income of $50,000 would receive $5,800 worth of a tax credit. And the threshold, the upper income threshold for that tax credit opportunity is at $88,000 in annual income. So that there are many households, as I just indicated, that in this capital region or in the 21st Congressional District would be favorably treated.
Congressman, there's a new poll out today, a new CBS poll out today that shows 42% of Americans don't understand the bill. 35% think it will hurt them. 20% say it will help. Fox News has a poll that shows 55% of the people oppose it. Gallup poll has a poll that shows 44% believe it'll make things worse for the United States.
Yes.
With those kinds of numbers out there, how do you sell this legislation?
Well, I think it begins with a sound dialogue to let people know what's in or not in the measure. Certainly 439,000 residents in the congressional district who have employer-based insurance coverage or purchase it through the private sector will be favorably impacted. They certainly will have a stronger outcome as it relates to insurance reform provisions that range from pre-existing conditions to rescinding care or insurance. If you have it, it can be suspended immediately. That's happened in many cases. This will now be precluded from being an option out there. And there's also the opportunities for 59,000 young people under the age of 27 they're allowed now to attach themselves to the family coverage. So many young people who are students in college or are new in the workforce are not getting health care coverage. So this is another important aspect. 1,100 families in the congressional district will avoid bankruptcy. Some 62% of bankruptcies for American families today are related to medical expenses. 78% of that 62%, Liz, came about when the catastrophic illness impacted them while they were then insured. So there are provisions here that strengthen that whole outcome, allow people to go forward without any lifetime caps on service and any annual caps on service. We are strengthening Medicare so that pharmaceutical needs will be met for the senior population eligible for Medicare, and certainly we're going to make wellness and prevention a free option. There's no copay, no deductible. Same improvements for the 439,000 residents who are on some sort of employer-based or private insurance plan. So these are improvements, vast improvements that I think, when you talk about the polling, I've also seen polling on the individual aspects that are contained in the overall omnibus bill. And each of those as a single dynamic poll high. And then when you put the package out there for polling, because it's been misinformed, the information trail has not been accurate as it should be, people are not as supportive. But it's interesting to see that those single dynamics poll very high and very strong.
That was going to be my follow-up to you, in that while each one of these provisions you talk about has the potential to help people, somehow the perception is out there that as a whole, this bill is not good, or it's not good for the American people. And that's what I'm talking about. How do you change that overall perception that healthcare reform in this package is wrong.
Well, I think we're going to do a lot of exchange, a lot of messaging so that people understand. We have encouraged people to call the office if they want to personalize this plan to their own individual household or family situation. We will talk that through with them. We're also going to reach out to the small business community, because with tax credits made available to them and with their opportunity now to join into an exchange, when you think of our small business as the backbone of the economy or the springboard to our economic recovery, small business is benefited because if you have 5 or 10 employees and just one of those employees, Liz, is impacted by catastrophic situations, your premiums can skyrocket as an employer. And when you're allowed to now enter a pool of many, many more employees where you attach your benefits to one another, the ebbs and flows of those given situations are shaved so that there's more stability, more security, more predictability, and a much stronger outcome so as to avoid the sticker shock of premium increase into the future. So that's a great bit of soundness and policy reform for our small business community.
And just to be sure that I understand, are you saying that anyone in your district can call you up and somebody will personalize this coverage for him or her?
Well, we will guide them in terms of what's included in the package if they're concerned about different aspects, or if, for instance, they have a child that's a concern in their family, a young adult who is a member of the household. If that individual is under 27, we will tell them how this insurance reform impacts them. If people are concerned about pharmaceutical costs, we can relate it to their given situation. We can give them income thresholds, and then they perhaps can fit the outcome with their own awareness at their fingertips. Wherever people call, our district offices are there to serve the general public. And I think that this is a major reform. I understand the emotion attached to it, but it's absolutely essential with forecasts of increases of $1,800 per year for a family plan that is already on average about $13,000 per family. A short decade from now, without reforms, would have found that price tag at $31,000. That's a train wreck waiting to happen. Businesses were at about a 60% percentage rate for coverage for their employees with employer-based opportunities just a decade and a half ago. Today, that's under 38%. So we can see the trends, we can see the forecasts, and something had to be done. Status quo would simply not cut it. And here we're able to put together a revenue-balanced plan in the format of a bill, and it also is deficit reducing to the tune of some $1.3+ trillion. So I think all of the aspects of this measure come together, the confluence of which are very powerful in the lives of the American public. And again, to have witnessed a vote here on the single largest healthcare tax cut for middle-income, middle-class Americans in the history of our nation is just a very strong piece of the package.
This makes me wonder what kind of reaction you have gotten from your district. Can you tell us how the calls were running? I'm assuming you, as most representatives were getting many, many calls. How were they running in terms of trying to sway your vote? And now, since the vote has taken place, what are you hearing?
Well, it was interesting. We had a mixture. I don't know what the last couple of days produced because we were literally getting thousands of calls. But it was running pretty much 50-50 as much of the polling had indicated. But we also now today are getting a lot of favorables from people. And interestingly, a number of people are finding out more about what was in there. There were so many things that I think were communicated to the American public that might have been negative aspects, which, by the way, weren't true. The pulling plug on grandma, the public option being included in the package, which is not the case. I still think it would have been a strong force for competition. And some of the unknowns about different thresholds and the pre-existing condition aspect, for instance, which is now precluded from being used as an excuse. These are reforms that people may not have known about, and when they're told about these individual